What are the types of lymph node biopsies for lung cancer? When it comes to diagnosing and staging lung cancer, lymph node biopsies play a crucial role. Lymph nodes are often where lung cancer spreads, making it essential to examine them closely. There are several types of lymph node biopsy procedures, each with its own technique and purpose. One common method is called endobronchial ultrasound-guided transbronchial needle aspiration. This is a minimally invasive procedure. A bronchoscope, which is a thin tube with an ultrasound probe, is inserted through the mouth or nose into the airways. The ultrasound helps guide a hollow needle into nearby lymph nodes to collect tissue samples. This method is particularly effective for lymph nodes located near the central airways and the mediastinum, which is the central area of the chest. It allows for both diagnosis and staging of lung cancer with a lower risk and quicker recovery compared to surgical options. Another procedure is called Mediastinoscopy. This is a surgical procedure performed under general anesthesia. A small incision is made at the base of the neck, and a thin tube with a camera is inserted to visualize and biopsy lymph nodes. While this method is more invasive than endobronchial ultrasound-guided transbronchial needle aspiration, it provides direct access to lymph nodes that may be hard to reach using a bronchoscope. This procedure typically requires a short hospital stay. Then we have thoracoscopy, also known as video-assisted thoracic surgery. This minimally invasive surgical technique involves making small incisions in the chest wall to insert a camera and surgical tools. It allows doctors to biopsy lymph nodes and lung tissue while seeing everything directly. This method is performed under general anesthesia and is often used when other less invasive methods do not provide clear results. Another option is the percutaneous needle biopsy of lymph nodes. In this procedure, a needle is inserted through the skin, often guided by imaging techniques like computed tomography or ultrasound. This method is usually used for lymph nodes that are near the chest wall or in other accessible locations. However, it is less commonly used for lymph nodes in the mediastinum. Lastly, there is the open surgical biopsy, also known as thoracotomy. This is an invasive procedure that involves making a larger incision in the chest wall to directly access lymph nodes and lung tissue. This method is typically reserved for situations where less invasive biopsies are not diagnostic or feasible. In summary, the most commonly used lymph node biopsy methods for lung cancer diagnosis and staging are endobronchial ultrasound-guided transbronchial needle aspiration and mediastinoscopy. These methods strike a good balance between diagnostic accuracy and invasiveness. Thoracoscopy and open surgical biopsies are utilized when less invasive options do not yield sufficient information. Percutaneous needle biopsies may be considered for lymph nodes that are easier to reach outside the central chest area. These biopsy procedures provide vital tissue samples that pathologists analyze to confirm the presence of lung cancer, determine the type of cancer, and assess how far it has spread. This information is essential for planning the appropriate treatment. The choice of biopsy type depends on various factors, including the location of the lymph nodes, the patient's overall health, and the expertise available. It is important to remember that all procedures come with some risks, and professional medical evaluation and care are necessary. Always consult with healthcare professionals for personalized advice regarding any medical procedures.